Diabetic coma. A diabetic coma is a hazardous diabetes inconvenience that causes obviousness. In the event that you have diabetes, hazardously high glucose, hyperglycemia, or perilously low glucose, hypoglycemia, can prompt a diabetic coma. In the event that you slip by into a diabetic coma, you're alive. However, you can't stir or react deliberately to sights, sounds, or different kinds of incitement. Left untreated, a diabetic coma can be lethal. The possibility of a diabetic coma is frightening, yet you can find ways to help forestall it. Start by following your diabetes treatment plan. Side effects. Prior to fostering a diabetic coma, you'll normally encounter signs and side effects of high glucose or low glucose. High glucose, hyperglycemia. In the event that your glucose level is excessively high, you may incite expanded thirst, incessant pee, exhaustion, sickness and regurgitating, windedness, stomach torment, fruity breath smell, a dry mouth, a fast heartbeat, low glucose, hypoglycemia. Signs and side effects of a low glucose level may include precariousness or anxiety, nervousness, exhaustion, shortcoming, perspiring, craving, queasiness, unsteadiness or dazedness, trouble talking, disarray. A few group, particularly those who've had diabetes for quite a while, foster a condition known as hypoglycemia ignorance and will not have the admonition signs that signal a drop in glucose. In the event that you experience any manifestations of high or low glucose, test your glucose and follow your diabetes treatment plan dependent on the test outcomes. In the event that you don't begin to feel better rapidly, or you begin to feel more terrible, call for crisis help. When to see a specialist. A diabetic coma is a health-related crisis. On the off chance that you feel outrageous high or low glucose signs or manifestations and figure you may drop, call 911 or your neighborhood crisis number. In case you're with somebody with diabetes who has dropped, call for crisis help, and make certain to tell the crisis workforce that the oblivious individual has diabetes. Causes. Glucose that is either excessively high or excessively low for a really long time may cause different genuine conditions, all of which can prompt a diabetic coma. Diabetic ketoacidosis. On the off chance that your muscle cells become starved for energy, your body may react by separating fat stores. This interaction structures poisonous acids known as ketones. On the off chance that you have ketones, estimated in blood or pee, and high glucose, the condition is called diabetic ketoacidosis. Left untreated, it can prompt a diabetic coma. Diabetic ketoacidosis is generally regular in type 1 diabetes, yet now and again happens in type 2 diabetes or gestational diabetes. Diabetic hyperosmolar disorder. In the event that your glucose level tops 600 mg for each deciliter, milligram per deciliter, or 33.3 millimoles per liter, mmol, the condition is called diabetic hyperosmolar disorder. Seriously high glucose turns your blood thick and sweet. The overabundance sugar passes from your blood into your pee, which triggers a separating cycle that draws huge measures of liquid from your body. Left untreated, this can prompt hazardous drying out and a diabetic coma. Around 25 to 50% of individuals with diabetic hyperosmolar disorder foster a coma. Hypoglycemia. Your mind needs glucose to work. In serious cases, low glucose may make you drop. Hypoglycemia can be brought about by an excess of insulin or insufficient food. Practicing too overwhelmingly or drinking a lot of liquor can have a similar impact. Risk factors. Any individual who has diabetes is in danger of a diabetic coma, yet the accompanying variables can build the danger. Insulin conveyance issues. In case you're on an insulin siphon, you need to check your glucose habitually. Insulin conveyance can stop if the siphon comes up short or the tubing, catheter, is wound or drops strange. An absence of insulin can prompt diabetic ketoacidosis. A sickness, injury or medical procedure. At the point when you're debilitated or harmed, glucose levels will in general ascend, now and again drastically. This may cause diabetic ketoacidosis in the event that you have type 1 diabetes and don't build your insulin measurements to redress. Ailments, like congestive cardiovascular breakdown or kidney infection, Additionally, may expand your danger of diabetic hyperosmolar condition. Ineffectively oversaw diabetes. In the event that you don't screen your glucose appropriately or accept your drugs as coordinated, you'll have a higher danger of growing long-haul confusions and a diabetic coma. Purposely skipping suppers or insulin. Now and again, individuals with diabetes who likewise have a dietary issue decide not to utilize their insulin as coordinated with the desire for getting thinner. This is a perilous, hazardous practice that builds the danger of a diabetic coma. Drinking liquor. Liquor can effectively affect your glucose. Liquor's quieting impacts may make it harder for you to realize when you're having low glucose side effects. This can build your danger of a diabetic coma brought about by hypoglycemia. Unlawful medication use. Unlawful medications, like cocaine and Delight, can build your danger of serious high glucose levels and conditions connected to diabetic coma. Intricacies. Left untreated, a diabetic coma can prompt lasting cerebrum harm. Passing. Counteraction. Great everyday control of your diabetes can assist you with forestalling a diabetic coma. Remember these tips. Follow your dinner plan. Reliable bites and dinners can help you control your glucose level. Watch out for your glucose level. Regular glucose tests can reveal to you whether you're keeping your glucose level in your objective reach, and alert you to hazardous highs or lows. Check all the more oftentimes on the off chance that you've practiced on the grounds that activity can cause glucose levels to drop, even hours after the fact, particularly in the event that you don't practice routinely. Accept your medicine as coordinated. On the off chance that you have successive scenes of high or low glucose, let your PCP know. The individual in question may have to change the portion or the circumstance of your medicine. Have a day off arrangement. Disease can cause a surprising change in glucose. On the off chance that you are debilitated and incapable to eat, your glucose may drop. Before you become ill, talk with your primary care physician about how to best deal with your glucose levels. Consider putting away at any rate 3 days of diabetes supplies and an additional glucagon unit in the event of crises. Check for ketones when your glucose is high. Check your P for ketones when your glucose level is more than 250 mg per deciliter, 14 mmol/L, on in excess of 2 back-to-back tests, particularly in the event that you are wiped out. In the event that you have a lot of ketones, call your primary care physician for exhortation. Call your primary care physician quickly on the off chance that you have any degree of ketones and are heaving. Undeniable degrees of ketones can prompt diabetic ketoacidosis, which can prompt coma. Have glucagon and effective wellsprings of sugar accessible. In the event that you take insulin for your diabetes, ensure you have a modern glucagon pack and effective wellsprings of sugar, like glucose tablets or squeezed orange, promptly accessible to treat low glucose levels. Consider a constant glucose screen, CGM, particularly in the event that you experience difficulty keeping up stable glucose levels or you don't feel side effects of low glucose, hypoglycemia ignorance. CGMs are gadgets that utilization a little sensor embedded under the skin to follow patterns in your glucose levels and communicate the data to a remote gadget. These gadgets can alarm you when your glucose is hazardously low or in the event that it is dropping excessively quick. Notwithstanding, you actually need to test your glucose levels utilizing a blood glucose meter regardless of whether you're utilizing a CGM. CGMs are more costly than ordinary glucose checking techniques, however they may help you control your glucose better. Drink liquor with alert. Since liquor can unpredictably affect your glucose, make certain to have a bite or a supper when you drink, in the event that you decide to drink by any stretch of the imagination. Teach your friends and family, companions and collaborators. Show friends and family and other close contacts how to perceive the early signs and manifestations of glucose limits and how to give crisis infusions. In the event that you drop, somebody ought to have the option to call for crisis help. Wear a clinical ID armband or jewelry. In case you're oblivious, the ID can give significant data to your companions, associates and others, including crisis staff.